And we are live.
Hello.
Hi, everybody. Welcome to another live educational session. We were originally scheduled at 2 today, and then we had to push it to 4. So we apologize for that delay. But we are glad to be able to come on and have this really cool conversation. Adina Adina, I'll let you introduce yourself actually. We work together at Mount Sinai, and I'm really excited for y'all to hear from Adina. So, Adina, take it away. Who are you? What do you do? Um, yes.
Awesome. Thanks so much. Yeah. So, where do I start? So, I'm a registered dietitian. I have been in practice probably over 15 years now, and I have been working. It's now the core clinic, but I've been working with the original staff that kind of started the long COVID research since I think June 2020. So, been working in this space for a bit. Outside of that, I am a performance dietitian for various sports teams over the last few years. And I specialize in, I guess, a couple main areas, which would be GI, so gastrointestinal issues, chronic illness, disordered eating and eating disorders, and then, of course, sports nutrition with my athletes. So, yeah, and continuing to study and learn and participate in all of the research that the core clinic's doing, which is amazing. Yeah.
Thank you. Thank you so much for being here. I had a really amazing conversation with you earlier this month and just telling you a little bit about, I guess, some of the questions that I have, as someone who is not an expert in nutrition or dietetics or anything like that. And as someone who is, I guess, I have a lived experience with long COVID, being that I was impacted by the disease and was in a severe state for several months, and really turned to nutrition as an answer for some things that were going on, but I never actually developed a good understanding of the relationship between my nutrition and chronic illness and like my
Mm.
dietary needs and everything. And so I'm hoping that our session today can provide some insights for both patients, for practitioners alike, and everyone in between and beyond. What exactly are the things to know? So I guess to just get started,
Yeah.
as you know, at CORE, we focus on treating and assessing and researching infection-associated chronic conditions. And so I know that one of the main symptoms of a lingering illness after an infection can be gastrointestinal.
Yeah.
Um, and so, can you talk a little bit more about what you're seeing from patients with IACIs?
Yeah. So, it can disrupt the gut in multiple ways. And, we could have short term or long-term post-viral inflammation or post-infectious IBS, changes in the gut microbiome, and the autonomic nervous system dysfunction can all contribute to symptoms such as bloating, nausea, diarrhea, constipation, reflux, temporary food sensitivities. Many patients experience changes in motility, so gastroparesis or rapid transit, so either really slow or really quick transit, small intestinal bacterial overgrowth, all leading to worsened GI distress. So it's common, but it is also very manageable when you're given the right diagnosis and it's explored in the appropriate way.
Thank you for that. And so, I mean, what are the most common nutritional challenges that you see in these patients? And I guess we could speak, particularly to long COVID, for example.
Yeah, yeah. So what I see, in practice is a lot of either unintentional weight loss due to maybe reduced appetite, taste or smell differences, nausea, or fatigue that makes eating difficult. A lot of people sometimes don't even have the energy. They used to love being in the kitchen. They don't have energy to cook anymore, let alone grocery shop. So a lot of the times it's, just not being able to eat as much or as frequently, which can then lead to blood sugar fluctuations due to, again, the poor intake, inconsistent intake, lack of appetite, maybe even autonomic dysfunction. The gut disturbances for sure. I'm maybe one or two that didn't have their gut affected. So from anything from like bloating, diarrhea, constipation, SIBO, post-infectious IBS, all the things I had listed earlier. And then nutrient deficiencies, again, from poor intake or increased nutrient needs due to the inflammation that they're not able to keep up with.
Oh my gosh. And so, how do you actually determine that someone has a nutritional deficiency? I'm guessing obviously blood work would be an indicator.
Yeah, sometimes though it doesn't show up there right away. So I'm going through when I have a patient prior to that appointment, I'm having them fill out an intake form with what a typical day of eating looks like for them, and I can pretty quickly determine where we might be having gaps. And then if I ask questions as to like how long they had been following this pattern of eating, we can kind of determine, what they're falling short on.
We have a comment from someone in the audience. Thank you for your input. They said, I know my histamine sensitivity and blood sugar was all over the place in my first few months post-COVID. All seems very complex. Does that sound about right for you?
Yeah. Yeah, no, that it can be so complex. And that's why I think it's important to get different insights, or at least that our group can provide from different types of providers to kind of put all this together for patients, because it can be very complex. And there's things that, I'll do a very thorough initial consult, and then people are like, oh, I never even thought to mention that to my doctor, right? So like, if we can all be connected and link each other up with, everything, the results of our core clinic testing, and then I can gather my information, it's easier when we collaborate and can kind of look at things together.
Yeah, absolutely. And then leaning on that note of histamine sensitivity, one of the things that we get asked about quite often when we hold these live streams is about like a low FODMAP diet. Can you explain what that is and also share some of your thoughts around that?
Yeah. This is a popular one. And it's funny, I work in GI, right? I can't tell you the last time I recommended a low FODMAP diet. And I'll go through, let me just talk about what it is, because even people that are on it don't know what it is. So the low FODMAP diet is a short-term, keyword, elimination diet designed to reduce fermentable carbohydrates. So FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. And there's different foods in each of these groups that can potentially trigger bloating, gas, and diarrhea, particularly in people that experience irritable bowel syndrome or SIBO, small intestinal bacterial overgrowth. And it is absolutely not a long-term solution for all GI conditions. And honestly, from what I see from the long COVID patients that I've met with, they're already not eating enough, and they already have other things that they've cut out. So it becomes super, super restrictive. I mean, and then if they go to a doctor and the doctor says, hey, do the low FODMAP diet, and they don't have a dietitian to follow up with to do it properly, because there's different phases and there's reintroduction. It's supposed to be done very specifically and followed by a dietitian. So I'll have people like, oh yeah, they mentioned I should do this, and they've been on it for a year. And I'm like, no, that's not how we're supposed to do it. So it's very highly restrictive. It can lead to unnecessary food fears, nutrient deficiencies. It doesn't address the underlying causes like gut motility issues, inflammation, nervous system dysfunction, SIBO. So we're just kind of like, if we're not still investigating, it's a Band-Aid. And many patients don't need to eliminate all their FODMAPs. There's targeted modifications that are often more effective. So instead, I usually recommend symptom-guided approaches that focus on individual triggers rather than broad elimination. Maybe we need to modify fiber intake for various reasons rather than eliminating fermentable foods entirely. Maybe eating smaller, more frequent meals to manage GI distress without overwhelming digestion, assessing food sensitivities individually. And the other thing is, like, if absolutely necessary, there is now an enzyme people can take that helps them break down these carbohydrates. So if needed, I'll recommend that to people before I recommend restricting your diet.
That's really helpful to know. And we do have a comment from someone, and they say inflammation and gut biome imbalance are associated with depression and other chronic conditions. Some people talk about eating only meat to reduce histamine response and inflammation. What is that? Like literally only meat? Have you heard that?
Well, histamine is not just in meats and okay, except they're only eating meat.
Only meat.
There's histamines in meats too, so I don't know why they would do that. But yes, there are foods that commonly tend to so I mean, I know histamine is a question that you have, so I don't know if we want to get to that topic or if you want me to go over that now.
We can certainly go into it now. Let's do it.
Okay. So histamine intolerance is what we're calling it. It occurs when the body has trouble breaking down histamine from foods, and it could lead to symptoms like flushing, headaches, GI distress, almost like allergy-ish symptoms. And post-infectious inflammation can temporarily impair histamine breakdown, but it doesn't mean that everyone that has post-viral illness needs a low histamine diet. And many patients tolerate histamine-containing foods when their gut health improves. Mm-hmm. The other thing is with histamines, we also get them from the environment. We get them from various sources. It's not just food. So first and foremost, we want to just confirm that that's a thing for us, right? So like, let's go to an allergist or a gastroenterologist that can tell us that we do have histamine intolerance, because we don't want to be just guessing and eliminating. So I like to think of histamines as like, there's a threshold. We don't need to avoid them completely, but if we fill up our bucket with too much in one day, including histamine foods and the environmental stuff, then we might trigger a reaction. Histamine comes into play also if you've been diagnosed with MCAS. So typically when you are diagnosed with MCAS, you actually go on an antihistamine, and you might trial, again, alongside a dietitian that specializes maybe in MCAS or histamine intolerance. You might trial that alongside maybe 2 weeks of a low histamine diet to see if it improves symptoms. And then again, there is a enzyme that can help you break down histamine. So we don't have to avoid them completely, and we just need to get on a regimen and routine to manage them if that's an issue.
Thank you for that. No, it makes sense. And we also have seen people develop new food allergies after, post-infection, basically.
Yeah.
How, and, you and I have talked before about allergy testing, and I don't want to say the legitimacy, they are legitimate tests, but what words of advice do you have for people who are maybe trying to navigate, they want to be knowledgeable about what foods to avoid, what not to avoid? What is the best way to go about allergy testing?
Yeah. So I think this has been such a hot topic too. Sometimes by the time people get to us, they've been to so many other doctors or they've Googled and researched that they've kind of done all this stuff. And, there's a lot of these self food sensitivity tests that you could do at home and order. And many of these direct to consumer IgG food sensitivity tests are not scientifically validated and can lead to unnecessary food fear and restriction. So these tests, and I'm trying to think of like I never look at them because they're all garbage, but I can't remember all the the brand names of the ones that are like out there that you can just order. But they measure IgG antibodies, which are actually a normal immune response to food exposure, not an indicator of intolerance. So true intolerances should be identified through symptom tracking and clinical expertise. And again, you can go to an allergist and get a true like allergy test. And it's the only way you're really going to understand that. And there's a big difference, I think, that people don't understand between like food allergy, food sensitivity, and food intolerance. So a true food allergy is an immune system reaction to a specific food protein that triggers the production of these IgE, not IgG, antibodies, leading to symptoms within minutes to a few hours after consuming the allergen. So they can be diagnosed through skin prick tests, blood tests, or IgE antibodies, or oral food challenges that you would do under medical supervision. A food sensitivity is a non-IgE mediated reaction that does not involve the immune system in the same way as an allergy, and symptoms can be delayed and non-specific. And I still think to this date, this is not like a actual validated like medical term under food sensitivity. Food intolerance is different from both allergies and sensitivities, and it results in the body's inability to properly digest certain food components, such as lactose in dairy or histamine in aged foods. Unlike allergies, they do not involve the immune system and typically cause digestive symptoms rather than systemic reactions. So, I think it's understandable, and it does happen where you seem to have these reactions to food after being sick or having chronic illness that you haven't had before. But sometimes clearing up these gut issues can help resolve a lot of these. And if they do come up, we just need to test them properly to know that they're actually there so that we can treat them.
And just, I'm curious, how can you tell that your gut is recovering? Does this involve like a stool sample, or what is the metric for that?
Yeah, I think it depends on what your symptoms are, right? And it's like a gradual resolve in symptoms. So some people come to me and they think like having diarrhea every day is their new normal. And it's like, no, let's look at these couple of things. Let's try this supplement. And then sometimes within a week, they're like, oh yeah, my diarrhea has resolved. If we figure out we have SIBO, you're going to feel like, what are your symptoms with SIBO? It's basically IBS on steroids. You're going to have really uncomfortable bloating. You may or may not have diarrhea or constipation. You might feel really gassy. You might have low B12. So once you get that treated, which can take a couple of rounds of antibiotics for some people, you're going to be like, oh, wow, like I'm not painfully bloated anymore. Or my bowel movements have changed. If your stool is discolored and we start to do proper treatment for whatever reason why it's discolored, and it starts to, go back to normal color. So it's all of these things that you start to have, like maybe you're not running to the bathroom as many times a day, or you are finally going to the bathroom. That's when you start to know that things are starting to function well again.
And SIBO is small intestine bacterial overgrowth?
Yes.
Okay. And so essentially there's a imbalance in the presence of various microbes that are in the gut, and that imbalance can exacerbate symptoms for the person.
Yeah. So those little critters, those little bacteria, they're not meant to be in the small intestine, and they kind of like sneak in there. And basically all their little gases that they're giving off can cause a lot of that painful bloating and digestive issues. So yeah, and there's different types of SIBO. There's methane dominant SIBO, there's hydrogen dominant, like there's a couple of different things to explore, and you want a GI that knows how to do the test properly and use the right substrate to determine which type it is. And then depending on which type it is, there's a certain recommendation for the medications that are going to treat it. And you can work with a dietitian in the meantime to help alleviate symptoms and not make them feel worse, or make sure that you're looking at your supplements that could potentially be making it worse. A lot of people take probiotics because they think it's going to make their gut better. And with SIBO, it's going to make it worse, most likely. So it's just like, working on those couple of things, and it can be completely solved. And some people go years and years with all these like terrible symptoms. And it's like, no, we just got to get tested and you're going to feel so much better.
And we do have a comment that I want to talk about, because we are talking about, taking some control back as far as your nutrition and your diet goes. A lot of people do turn to supplements. And you did mention a few supplements just in passing in our conversation. But what is your opinion on supplements? Do you recommend supplements to your patients? And what validity is there to supplements? I mean, I know that there is some, but people want to hear. Yes.
Yeah. So what I want to say about supplements is we have to start to think of them not just like they are these natural things that we're going to take. We have to think of them like almost like part of your medication. And I'm not saying they are medications. They're not going to do that kind of job. But, there are dangers for taking excessive supplements or not knowing certain supplement interactions, supplement food interactions, supplement medication interactions. In school, when I went to school as a dietitian, we had a book like this big of all of the interactions, and we had to cross-check everything. And, I understand why patients with chronic illness are looking for other ways to heal themselves when other things aren't working. But sometimes they come to me with a list of like 20 supplements, and I'm like, how's your liver enzymes doing? Like, how are we doing here? And, so they're not considering that there can be interactions or redundancy. So I'll also see people taking green powders, which are basically a multivitamin, plus taking a multivitamin, and it's like, okay, cool. We have 300,000, of our percent of our B12. Like, we need to start to peel this back and assess what do we actually need. So we want to avoid nutrient overload. We want to avoid medication, food, supplement interactions. We can worsen symptoms with too many supplements. That a lot of them can cause GI upset, and the timing of them is important too. Like, if you take, for example, like, this wouldn't be a very specific to our population, but like as a quick example, if you take calcium and iron at the same time, it's not going to get absorbed. Like, there's certain things that like, hit each other away. And then the financial burden of all of this, like, it's expensive to get high quality supplements.
Very.
It's so expensive. And when you have a supplement, if you go into CVS or if you go into GNC or wherever, and you see a supplement on the shelf, it does not have to be tested for safety or for accuracy before hitting that shelf. And I think a lot of people don't know that. Our government does not recommend, does not look into supplements until something goes wrong. So best case scenario, you've got exactly what it says you have in there. There's no other additional harmful ingredients or substances or mega doses or anything like that. But worst case scenario, there's some harmful substances or mega doses or whatever. So, I think you have to be really careful about what you're purchasing. And it's interesting because in the sports world, because of doping and testing, they have very strict policies around, number one, just like supplement research. Do these things actually work? And there's very few of them. And then safety. So there's certain third-party tests that you can look for that were made for athletes and doping, but I tell my patients to look for them anyway, because we want to know exactly what's in our stuff. So NSF, Informed Choice, Informed Sport, sometimes USP could all be things that we look for on the label to ensure that we are supplementing safely. And when do I supplement? Again, I'm doing a full assessment of their intake. I'm doing an assessment of their medications, their other supplements. We're looking at lab work. And we're also looking at, are you eating enough? Because yes, while some supplements can help us fill the gaps until we are eating enough, a lot of the other supplements, it's like we need to work on food first. Like, supplements are at the tippy top of the pyramid. We need to make sure that we are nourishing ourselves as best we can from food, because that's also where it's going to be absorbed the best versus a synthetic.
That's really interesting. let's see, methylene blue. Have you heard of methylene blue? I, and someone asks, is there a mechanism for recommending it for long COVID?
For that specific one, or just supplements in general?
I guess supplements in general, that specific one they're asking about.
Yeah, that one I haven't really heard of. I would have to look into it again because I've worked in pro sports for like 6 or 7 years now. So we are always looking at like what is the latest and greatest supplement that can enhance health and performance. So if it hasn't come across my lap, it's probably because it's either there's not a lot of research to back it up, or again, like it just hasn't been validated elsewhere. So if it's super new, I need to like look at the mechanism of action and why it's being prescribed and if it's something that would actually be helpful. So that one hasn't really come across my lap. I think it's actually like it sounds like it's for a certain condition that sounds familiar, but it's nothing I've ever recommended.
Fair enough. And this is a great point. What Christina said, what if we can't nourish ourselves well because we are bedbound and can't cook a lot? I mean, that's a super valid question. I would say, for me, I was bedbound for a few months and cooking was the last thing that I could do. And that also in turn made eating very difficult and maintaining good eating habits and good association with food because I mean, I just couldn't, it just wasn't a good situation at all. So it's kind of like a tough situation to be in. What can people do if they're not mobile to get a good meal, a good nutrition?
Yeah. And I've had so many patients like with the same situation. And what I'll do is I'll kind of work with them to determine what's accessible, right? So, of course, you could do meal delivery service, but that can obviously get expensive. Or is there someone that can help with meal prep? Other than that, I think of things like if there's no one that's around to kind of help on the day to day, what can we make that doesn't take a lot of energy? So maybe it's a lot of smoothies. Maybe we get an Instant Pot or a crock pot and make a batch of things that you could just like on a day that you're maybe feeling better, that you just dump in there. Maybe it's as simple as like rice, chicken, and broth, and you just follow the cooking directions and like you let it cook itself, right? Going back to just very simple things like simple sandwiches or things, again, that might not require you to turn on the stove or the oven. If it's really difficult, getting some bars that contain, some good protein in there and carbohydrates, like that are maybe, even if you're tired, like can't really, if you get tired from eating, right? Sometimes those more compact nutrition bars can be really helpful when you don't have energy to get out of bed and start to make something. Because sometimes it's like, we're low energy already, and then we're not able to eat. So then we're even more low energy to even want to get up. So maybe even just keeping some of those things ready to drinks, maybe like some OWYN shakes or Kate's Farm or some other, like they're all over like grocery stores and convenience stores where maybe that's just like sitting on your bed ready to go. So you can just kind of get your blood sugar stable and, get yourself through that, part of the day where you're trying to just like get up and get something to eat. So
and I get that. I like unfortunately lived off of Ensure for like months.
Yeah.
There was a lot of shame in that though. I just not feeling like I wasn't doing enough for my body, but at the same time knowing that I was doing all that I could.
Yes.
Do you feel that there is I guess a psychological hurdle there when you're not physically able to do what you feel like is going to give you the maximum value for your nutrition? And like, I guess, what is a way that people can at least offer themselves some grace? Is it okay to like, to like, what is the bare minimum that someone really should be doing, I guess, if they're really, really heavily impacted?
Yeah. Bare minimum, I sometimes don't care what you're getting in. We just need to eat enough.
Okay.
That is your body's fuel. That is how it's going to fight infection. That is how it's going to heal. I don't care if it's out of balance, out of whack with like our carbs and our protein initially. We need to get enough. That is first and foremost. And then we could be thinking about our macronutrients. Then we could think of like micronutrients. And then we could think about supplements. But I think everyone that is struggling with that really needs to give themselves some compassion. And it doesn't have to be this very perfect meal or like clean quote unquote meal. Sometimes we need to get in things that are, Ensure was made for a reason. It's got like all the multivitamins, it's easy to drink, it's made for people that are unwell and can't feed themselves. And sometimes we need to go towards some of those things that are out of convenience just to feed our bodies. Because we're going to feel if our blood sugar gets low, if we start to get malnourished, we are going to feel worse, and it's going to be harder for our body to fight. So I think at any, even I've had people like, oh, like I need to avoid sugar or carbohydrates or what. It's like, no, like eat if that's what you're in the mood for, because that's what your stomach can tolerate. And this is even outside of like chronic illness too. Sometimes people with GI stuff, I have to work on taking out a lot of the fiber for some, and everybody's like, but I've always learned I need to have whole wheat and brown rice and, tons of veggies every day. And it's like, that's not what's healthy for you now. What is healthy for you now is eating the foods that settle well in your gut so we can resolve this. And what's healthy for somebody now that's in bed is to get adequate calories in any way they can. So it's like shifting your perspective on what you might deem as healthy for the situation that you're in.
Yeah. And it does seem like a really delicate balance, because people may have reactions to certain foods that they didn't have before. And like just walking that line is very, very unique to everyone's individual journey. I just want to recognize that. And it is very affirming to hear from you as an expert saying, like, it is okay if you are simply just doing your best and not be so hard on yourself if you don't have a perfectly balanced nutritional diet every single day. I mean, that is very unrealistic for many people, especially if you're bedbound and especially if you don't have financial means to access really high quality food. So, yeah, thank you for that.
Yeah, no, that's a really good, I'm glad somebody brought that up, and it's a really important piece, I feel like, for, and I'm hoping that just helps somebody to feel like, okay, that's the one less thing I need to stress over. Because let's not forget, like, the amount of, if we're really focusing on our food and eliminating things and stressing over food, that stress is in the body too, and that can increase inflammation. So let's not make diet one of those things that we're extra stressing about.
And that is actually what someone wrote. Are there any diets or foods that you recommend to help lower inflammation? Considering what we said about the low FODMAP diet earlier, if someone has a concern about inflammation, how do you actually address that from your standpoint?
Yeah, and I think if there's an inflammatory response going on in the body, again, we want to determine what's the root cause, where is it coming from? And if it is a longer term like healing process, then we can kind of focus on like, okay, what are a couple of things that we want to be doing? But again, if we're having a lot of like inflammation from our gut issues, and we can resolve the gut issues, right? Like there's things that are outside of food. It's really funny because for the first time ever, when I was starting this long COVID research, in general, people were talking about, oh, this is anti-inflammatory, inflammatory. When I tell you, I could not find one paper that was like, this food is absolutely inflammatory when we're talking about a lot of popular foods in that category. The one that I will just say is I will say probably causes inflammation or does cause inflammation is alcohol, but that's not really a food group. Mm-hmm. So I think people really latch onto that. And it's like, we need to clean up that research a little bit. Now, are there foods that are potentially anti-inflammatory and a little helpful to the system? Yeah. And that could be in the form of our, fruits and vegetables, which we could throw up in a smoothie. It doesn't have to be any particular way, especially because fruits and vegetables can sometimes be some of the things that really trigger our GI symptoms. So we don't want to add inflammation by adding those things. And then omega-3s, fatty fish, walnuts, flax seeds, sources of omega-3s, or maybe supplementing with omega-3s. Then there's ginger, doing ginger tea or cooking with ginger. So there are some things. Is it going to really make or break? And is it more important than managing stress around food? Probably not. But again, it doesn't hurt to, if you can stomach it and if it's healthy for you in that moment, to be incorporating those foods and making sure you're managing your blood sugar so the body's not stressed out. So eating frequently, and the timing of that might shift depending on what you have going on. But in general, most people need to eat every 3 to 4 hours to keep their blood sugar stable. So stability in that is going to be really helpful too.
100%. And I'm really glad that you talked about locating the source of the inflammation. And I'll just speak from my own perspective, dealing with long COVID and being severely impacted for a short amount of time. I was having extreme reactions to eating, but it turns out that that was actually related to my autonomic nervous system. And just, it was very heightened and just very inflamed at the time. And so even just changes in, oh, she's digesting something, my body would be like, panic, panic, panic. And I thought that it was because, it's because I might be eating something too sugary, or maybe it's too many carbs, or maybe it's too oily. And then it was stressful. On top of dealing with like the natural panic response that was occurring because I was sick, it was important for me to figure that out. And I will also say that, at the time, my doctor had no idea what was going on with me, and he misappropriated what was happening to an eating disorder. So I think, and that is actually something that I've heard from other people who have struggled with these illnesses, is that when they go to their doctor and they're saying, I'm struggling with eating, I feel like there's a fine line between, is there a fine line? Like what is actually happening?
Yeah, I think there's a big difference between an eating disorder and a digestive disorder, obviously, or lack of appetite. I think anorexia was originally in the literature as like no appetite. And I think maybe the nervosa was added on to be like the eating disorder part, anorexia nervosa. So that's interesting. But I think that, good for him for kind of looking out for that, because eating disorders go undiagnosed every single day. And in a lot of ways, like chronic illness, it's a population that very easily develops disordered eating and eating disorders, again, due to some of the restrictive diets that are recommended, or because you're convinced that certain things are causing symptoms because we're not evaluating other things. Or, we're all, when you're not feeling well and you can't get back to yourself, it's like, what can I control? What can I control right now? Right? Or they go and do the research or look up somebody that's big on the internet that has no idea what they're talking about in the nutrition world and don't have a nutrition degree. That's another story. But yeah, it's, I think I could see where the confusion would be if someone doesn't understand the chronic illness, but there are a lot of great, easy screening questions to determine if it's more of an eating disorder versus just the illness. So, and most doctors aren't trained in that, right? Like eating disorders. So, again, good that they were looking out for it. But it, they would know how to assess that appropriately.
That's affirming. Yes, I think probably we need to listen to more of Core's live streams so that they maybe, when they see someone who is post-infection, they don't just jump to you don't
want to jump there, but I do think we should be cautious around it because the development of that is more prevalent than a lot of people realize. So
absolutely.
Yeah.
Yeah. Thank you for that. Um,
Yeah.
and so now we're kind of diving a little bit. I know we don't have much time left together, but this is actually something that we get asked a lot on our
Mm,
live, and it's about fasting. Um,
mm.
this is not the first time that I've seen, and thank you, Laura, for your question. Someone say that they felt better when they were fasting. What do we know about fasting? What are your thoughts on fasting? Happy to learn.
Yeah. So again, because a lot of people are already so sick, like the fasting is really difficult because obviously it's going to affect our blood sugar. It's going to affect our total ability to get enough nutrition. For women, it's really not helpful because while men are on a quick 24-hour cycle, we're on a 28-day cycle for the most part. And that really, really negatively affects our hormones. So I do. I've had some people recently that have also said, it's because they're on stomach rest. I think that they feel better because their digestive system isn't acting up. But I have never found it helpful to do any type of fasting because you're likely not going to reach all of your nutrition needs to help you heal and feel better. And it can also lead to disordered eating and eating disorders if someone's what's the word, susceptible, and because of its effect on hormones. So I think when we're not feeling well, consistency of fueling is really key to feel nourished and to keep our blood sugar stable, because we could also feel like absolute crap when our blood sugar is low. And if you go from not eating for a long time to then eating and then feeling very full, that's going to really negatively impact your digestive system. And I'll also say for people that usually experience a lot of bloating and discomfort, sometimes big gaps without fueling can increase bloating due to your body just kind of like secreting that acid, waiting for the food to come, and then we just kind of get that bloated feeling. So yeah, I don't know what particularly it would be used for, but I could have arguments against the digestive part of it, and I could have arguments about any type of healing part of it.
That makes sense to me. I trust your opinion. You are the expert. And
Yeah.
your thoughts.
Yeah, I think a lot of times people feel better because it's just like their body doesn't have to digest. So we have to figure out what's going on GI wise to help you feel better without having to fast.
Absolutely. And so that kind of brings me to my last point and question is um, I think that people, if they can, should integrate a nutritionist, a dietitian, someone to help them navigate their journey with food if they have a chronic illness. I think that should be required in a health plan.
Yeah.
So how do you work on a team to develop a comprehensive treatment plan for someone who is dealing with a post-acute um, or infection-associated chronic illness?
Yeah. I think it's so, I've worked in teams in every setting, right? I was in private practice working with eating disorders. So it was like, I'm on the phone with, if it's a younger kid, it's the parent, it's the therapist, it's the doctor. We're all collaborating. When I'm with my sports teams, I'm collaborating with the rest of the performance team, the PTs, the ATs, our medical director, our strength and conditioning coach. So I think the best way to help anybody is to form a team around them, so you get different opinions and ways to kind of figure things out when things are complicated. So usually when I'm working specifically for patients in the core clinic, they're usually getting evaluated and doing a lot of their testing first. So NASIA does a great job of helping, at least screening for what are the digestive things going on, and can then refer to me, and then I can get back to her. I've gotten back to her with like, hey, we need to do this test, this is what's going on, and then we kind of resolve it pretty quickly after they've been having these symptoms for a really long time. And then it's her sharing some of the testing information with me. Obviously there's some nutrition related things when it comes to autonomic dysfunction or POTS. I myself have dysautonomia, so I totally get how that feels. And there's a lot of nutrition things that could be done there. So it's really about what's great is we can share all the files, we can share all the testing, and then we're communicating, whether it's a call or whether it's in the portal. Hey, saw this person needs this testing. Let's talk when they get everything done. These are the labs that we need to get done. And we'll kind of look at everything as a whole from different perspectives to say, okay, these are going to be the next steps.
Thank you, Adina. We're out of time. Everyone, thank you so much for tuning in. Thank you for your input. And thank you again, Adina. You are amazing. Can't wait to have you back on. Keep killing it.
Yeah, thank you so much. It was a pleasure to be on. I always love chatting about this stuff, and thankful for what you do. You're, amazing in this space. So everyone's lucky to have you.
Same to you. Have a great day. Bye, everybody.